Hi, everybody. I know I've said this a lot lately, but I really am so excited to have our guest on today because Dr. James McOwen, we met in graduate school as just young, carefree 20 somethings.
That's right.
And it was such a special friendship. And again, it's not the only reason I started this podcast, but a big reason I love it is to see people who I don't get to see as much every day. We had this like 4 to 5 years of like what, trauma bonding, James, would you
I
say?
would say trauma bonding is the right way to
Yeah.
characterize it.
And now that we're happy and healthy and adults, we don't see each other nearly as much. So anyway, so this is my excuse to hang out with you, but I'll stop there for a little bit. And James, why don't you tell people your fancy titles and stuff?
Thank you so much, and thanks for having me here. So James McCann, I'm a clinical child psychologist. I'm a assistant professor at Harvard Medical School and Mass General Hospital, where I run a clinic for teenagers and young adults with substance use disorders and mental health issues. So I work a lot with college students. You know, Boston, we have
Mm,
100,000 colleges in Boston, so
yeah.
and we see a lot of college kids, and I have lots of college kids as my patients, clients.
Yeah, yeah. It's interesting. How many, isn't there some statistic like there's X number of students in Boston versus non-students? I mean, it's a
Right.
it's like,
Right, it's like sheep in New Zealand versus humans type of thing, right? Way more college students than like non-college people.
yeah. All
James,
right.
I'm detecting an accent. Are you from somewhere?
Not New Zealand, actually, from the United Kingdom. There are a lot of sheep in the UK as well. We talking about sheep today or alcohol? I forget. Anyway, I'm British, yes.
Yes. Okay. I mean, I have been to New Zealand and I did see a lot of sheep, so I really got that. But no, we are going to talk about alcohol. Um, and we're so lucky to have somebody who's really seasoned in research about this and also sees a lot of people clinically. Okay, so we know that college is a time for experimenting with alcohol. I feel like a lot of teenagers, it's like their first exposure to the drinking culture. What's your opinion though? And I really, this is a big debate amongst patients that I see about what's typical versus atypical in terms of drinking as well as drug use in college. And I'd love to hear your thoughts about that.
Yeah, I think college drinking, if we talk about alcohol specifically versus other substances, so people that go to college do have higher rates of alcohol use compared to people that don't go to college. And we know that it's more normative in college, right? You think about going as a freshman. I mean, I went to the United Kingdom where like drinking culture is even bigger than the United States. And the first week, or called Freshers Week, because you're a fresh person there, I guess, I don't know, is characterized with a lot of partying and drinking. And we don't have kind of Greek culture in the UK, but there's a lot of drinking in sports, and here in America too, a lot of fraternities and athletes tend to drink a lot. So it's definitely normative to drink in college. I think about 70% of college kids do drink, but problematic drinking is much less, of course, but about still a decent amount, about 7 to 10% depending on the study, which is higher than non-college populations. And it's normative as a freshman, sophomore, and then drinking starts to kind of turn towards lower use as a junior and a senior. And so by the time people leave college, their drinking is definitely much lower than it is as a freshman.
How many sheep drink? No, I'm teasing. Um, I'm curious about that. I actually did not realize, although it makes sense thinking back, like I didn't realize that it would be going down junior and senior year. Is there a couple of reasons why that is?
Yeah, I think a couple. I think some people who've struggled with to regulate their drinking in freshman and
Hmm.
sophomore year have maybe had to leave. Like I work with a lot of college students on medical leaves
Yeah.
or they need to go on treatment leave, and so it might sort of filter out. But then again, people start to become more serious about their academics and they look to do kind of internships and they're looking at graduation. So they're a little older too, and so I think they've accrued some consequences, they're tired of being
Hmm.
hungover or whatever it might be. So I think there's a shift there as well. Plus the peer, right? The peer influence is so huge in college that your peer group is also tends to be drinking a little bit less, so it all kind of affects each other.
I was also thinking a lot of the Greek culture, frat rush and sorority rush, and the drinking and partying that goes around that as well. I can imagine it feels like, okay, you can stick with the herd, so to speak, mentality of that. So there's a lot of drinking with those types of events. But if you do still plan, right? Because I know that a big part of what we don't want to say is like, hey, all drinking is bad. Of course, we could list all the different health reasons why it's safer to drink less, but it is college. We know, to your point, you said that around 70% of people are drinking. So let's say you still plan to drink. You're not listening to this because you want to drink less, but you're listening to this so that you can stay safe. What are some safe ways to drink, smoke, do drugs? Is there a safe way to do it?
Yeah, great question. It depends on who, if you think about just, what's your doctor going to tell you? They're going to tell you that any alcohol and drug use is bad for your health, and they're correct. It is
Yeah.
not good for our health, right? We know that. And at the same time, we still do certain things. So if we think about harm reduction, which is this idea of like, if you're going to do it, let's try and do it in as safe a way as possible.
Mhm.
So that would be watching how much of the substance you drink in a short period of time. So college is particularly like, you pregame, you drink some shots, then you go to the party or whatever, and you're doing flip cup and there's a keg, and like you're drinking quickly. You're drinking a lot of booze really quickly. You're often drinking mixed drinks. You don't know what was in it. Some dude is pouring it for you. It could be 2 units of vodka, it could be four. You have no idea. It all tastes terrible, right? As I remember, kind of terrible mixed drinks from various parties, right? So
Right.
you just got to be careful, like how many drinks you're drinking per hour. And so binge drinking is obviously 5 in 2 hours for a guy and 4 for a female. And so if you can watch how many drinks you drink per hour, so maybe 1 to 2 an hour at most,
Hmm.
you can switch out to like a soda, or you don't want to be the kid that's walking around with nothing in your hand. So fill your like red cup with soda water or a
Right.
light beer or something like that. And the
Hmm.
liquor is often where kids that I work with get in trouble. Certainly you can drink a lot of beer, and beer can be quite strong, right? But liquor is where people get into trouble.
Yeah.
And so watching liquor, watching mixed drinks, making sure you've eaten, right? So have that pizza before you head out, eat the burger and fries. That doesn't change the amount of alcohol, but it releases it more slowly, because what happens is that you drink that alcohol so quickly, it just kind of really floods your system. But if you
Oh, okay.
eat, it releases it more slowly, more gradually. So it's a little bit safer in that way. So those, I think, are some top tips. I think for, women in particular, you've got to be careful with binge drinking and drink. That's where, unfortunately, women both metabolize alcohol more slowly. And so 4 drinks for a woman is actually way more than it is for a guy. And that's to do with fat and all that kind of stuff. So girls nowadays are almost drinking to catch up with guys or as much as guys, and there's a
Mhm.
culture around that, but they can get drunker faster as
Hmm.
well. So that's definitely something to pay attention to, depending on kind of your gender identity or your gender.
Yeah.
Okay. So that's not a good transition. I want to like respond in some way, but I need to think about it. Okay. So there are some tips I think that are really helpful in terms of, and things I probably wish I knew in college around how many drinks you can kind of keep an eye on in terms of staying safe when you are drinking. So we're talking a lot of like social factors as to maybe, and that's when I think about even my experience in college was like everyone getting together, going to a party, going to tailgate before a game, and drinking. But that might not be the only reason why college students are drinking. Can you share some other reasons why there's an increase in alcohol use in college?
Yeah, I think for some people it's like you said earlier, Liz, like their first time being away from home, they're not in their high school, and so there's this sense that this is something you can do. There's a belief, right, that this is what you do at college. You kind of use substances and you get drunk. So that's a piece of it, right? Our cognitions, our thinking patterns. There's definitely more availability, right? So people often go to colleges in cities. They may have more access through parties, so they may just encounter alcohol more frequently. Athletes, like I said, those in particularly lacrosse kids have high rates of alcohol use
Yeah.
Huh.
compared to kind of other. It's definitely, it's not my total area, but I know different sports groups have,
Yep.
some have higher rates of use than others. Gender, right? We talked about boys tend to drink more than girls broadly. And then, of course, those who are struggling with a mental health issue.
Hmm.
So if you already have sort of an anxiety, depression, OCD, ADHD, you may, if that's not well managed or controlled, tend to, when you drink, you might end up drinking more to kind of self-medicate. And then, of course, there's other factors like if you have a family history of addiction, you're going to be more at risk for more problematic alcohol use than say you don't have that family history, which
Mhm.
sucks because there's nothing you can do about your genetics. So,
Yeah,
yeah,
I know. And some people might be aware of that as they go in, and some people might be figuring that out a bit as they
right.
go. So I know that that certainly can happen where it's like, wait, why am I having a harder time with this than my friends are? And it might have to do simply with genetics or something that you can start to do a little digging about, perhaps, if that's the case. I
Yeah.
do think the idea of struggling with a mental health issue, or even if you're just dealing with some general college stress, we've talked about the amount and kind of where that might be normal or atypical. But what about more problematic reasons for drinking? Do you find that there's times when you start to worry about that self-medication? And do you have any signs of what that would be different from your typical just going out with friends and
Yeah, definitely. I think we think about a lot of substance use is to have fun, right? Like pretty normative and that's been, that's pretty evident that people do that to enhance their experience, and that's pretty normative and tends to be okay. But when use is either done alone or as a way to manage depression or stress, I'm so anxious I need to drink to calm down, or I'm so anxious socially, I'm going to get drunk before I go out. So when it starts to take on a functional role to manage difficult emotions, to escape or avoid or change something, that's when it can start to become a problem because that is very reinforcing. And so that's when I think drinking or any other drug use really can become sort of start to move into the not so functional space.
yeah. Obviously, I know you wouldn't talk about a specific person or patient of yours, but can you give an anecdote of like, hey, here's what it can look like when you start to do that? And you mentioned, oh, it can be really reinforcing, or the function is it like, is there sort of a story you can tell about a typical student? Names have been changed for the sake of this podcast kind of thing to say, here's a cycle that looks familiar to me when I start to see this.
Yeah, I can think of one recently, a college student, and he had social anxiety disorder, so really struggled socially. Whenever he would talk to other people, raise his hand in class, he got anxious and sometimes would avoid that. And so trying to build friends and connections was really hard for him. He would often sort of stay in his room and was missing out, and then started to use alcohol and cannabis to dull those feelings of social anxiety. And so
Mhm.
would then find himself, drinking by himself in his room before he would go out to meet friends socially.
Mhm.
And started off, not that big of a deal, would have a couple of drinks, but then started to get tolerant and
Mm.
then needed more and more alcohol and cannabis to feel comfortable. And so found himself buying liquor, like shots, and then would go to the bathroom while he was out and drink more, and eventually would get quite intoxicated. And it became sort of this problem because he would then sort of make a fool of himself, to be honest. Like
Yeah.
other people, like he'd be way more drunk than other people. He would get aggressive. He was maybe struggled with boundaries, touching people inappropriately. So it actually started to exacerbate his anxiety because people would
Wow.
talk to him the next day, like you were kind of a fool last night and
Right.
you were sort of a mess, and it started to have this vicious cycle experience with him. And so then eventually kind of he got so intoxicated that campus police came to his dorm, and that's how he ended up coming to our clinic. And so we were working on really addressing both his alcohol and his social anxiety.
Yeah.
That's such a I see that all the time. A common example, I can think of like three people that I'm like currently seeing, but this pattern of anxiety going out, right? Then engaging in behaviors that are shameful and embarrassing. And then I tend to see a lot of cannabis use during the daytime the following day.
Yeah,
Which then has led to like a lot of academic impairment, of course. But then, of course, like eventually, like getting the willpower to like go out again, but needing more alcohol, but like this, like leading to a lot of academic impairment, of course. But
right.
I see that a lot, and particularly in females, where they might have engaged in dating behaviors or sexual behaviors when they're intoxicated, and then using cannabis as a way to avoid some of the difficult emotions they're experiencing, as well as the come down from drinking.
Yeah, super common. Yep, I have another young female college student where that was a very similar pattern.
Right.
Hers was more depression than anxiety, but was missing home and missing her friends and was really struggling to adjust to college life, which I think isn't talked about a lot. I think some people think, oh, you're just going to be great and it's going to be the best experience of your life. And she really
Yeah.
struggled with her academics. And so she would use cannabis and alcohol to deal with depression, which became its own kind of vicious cycle. One thing to note is, mixing substances is something I didn't share before, is something to think about.
Yeah.
And so mixing alcohol, cannabis, alcohol, cocaine, alcohol, anything else is going to really intoxicate you much faster. And then the other one is if you happen to be on psychiatric medication, so if you're on a SSRI or you take a stimulant, you're going to get drunker faster.
Hmm.
And some people don't know that. And
Hmm.
so 4 drinks for them plus their psych med makes them really intoxicated quickly.
Yeah. Right. They might have had some sense of their tolerance before and after, and not realize, oh, I can't do it like I used to necessarily. We've talked about where things can be difficult and why social anxiety might lead someone or depression might lead someone to go there. And I can imagine that the things that they could do differently, like, okay, we're going to work on social anxiety, or we're going to work on depression. A lot of times when I'm talking with people in college, I'm like, there's nothing I can probably offer you that's going to have that in the moment quick fix of relaxation, the same way that alcohol can, right? So I know this is not going to be a simple answer, but I'm just curious for those people who are like, okay, I'm ready to try something different. What would be a good first potential step? Nothing's going to make you feel as relaxed as quickly as a shot, right? There are other alternatives. What would you say
Yeah,
is a starting point?
it's a really good point to admit that that's true, right? Because I think
Yeah.
often people don't admit that actually drugs and alcohol work really well in the short term, and you can't really deny that. Nothing is going to feel as good typically in terms of sort of the dopamine rush and the reinforcing pieces of it. So sometimes just admitting that that's true
Yeah.
is an important first step. And then I think it is really tricky to navigate how to manage, difficult emotions or social situations when you've been so reliant on a substance to do that job for you. And
Hmm.
so definitely working with a counselor, obviously, or a therapist to look at what are the triggers for you, what are your situations that are hard for you to deal with, what are some strategies to navigate that, relaxation techniques, cognitive behavioral therapy, as well as finding other ways to socialize, right? That often I talk to college kids around, this doesn't mean you can never socialize. It might mean that you have to shift up the ways in which you socialize. So maybe you're not always going to parties, but maybe you can do other stuff that's fun, that's rewarding for you, that may not increase your risk of using a substance.
Hmm.
Um, it does for some students who have more problematic use mean they may have to shift up some friendships. They may have to expand their network to maybe people that don't use as much, join other groups or societies that may not be associated with heavy use. So
Hmm.
sometimes it does need for the person to make it a substantial change, but it is just generally a journey and a process of figuring out how you can still have fun. Because that's if you're not having fun and you're not enjoying it, then why would you stop doing it? So you have to figure out how to find something enjoyable and fun to do.
Right, right. I'm also curious about people who would worry, if I drink less, what would people think of me socially? Right? Will
Yeah.
I become sort of an outsider? Do you have any insight into, is that automatically true? Any hope that
Yeah,
there might?
it's a really common thought to have for sure, right? Especially if you are prone to depression or anxiety, think people are judging you and all that kind of stuff. So I generally think that most people aren't paying that much attention to your drinking behavior when you're out. Certainly they might be like, come on, have a drink, and you can say, I have one and I'm good. And we teach college kids refusal skills, which is just a quick line to say I'm good, or I'll get
Mhm.
one in a minute, or I'm on a med right now. Just
Yeah.
something you can say quickly just to
Hmm.
divert someone's attention.
Right.
But generally, most people aren't sort of counting your drinks and aren't that focused on you. And then having a quick cup with you, like something to carry around. There's tons of non-alcoholic drinks nowadays. They look the same. They taste pretty much the same.
Hmm.
Other options in that space as well to do that.
Yeah. Yeah.
Something that I've noticed, there's a trend, and even among my patients around sober curiosity, right? And I've seen a huge shift from replacing alcohol with cannabis and somewhat normalizing cannabis use and kind of in some ways saying to me, my patients at least, like, it's not as bad as drinking, even though I tend to say, and if any of my patients are listening to this, I'm always like, would it be normal to like wake up in the morning and take a shot or take a shot before you go to bed at night and do that every single day? And they're like, no, my God, I'd be an alcoholic, right? Of course. So I'm just curious if like any thoughts of, I mean, I think it is a substitute behavior. People think it's not as bad, right? Maybe their behavior is not as dysregulated as it might be if they're using alcohol, but is there any like research or like why people might be more prone to alcohol use versus using cannabis? And any thoughts about if you've seen this pattern that I've seen in terms of maybe using cannabis as a replacement strategy for alcohol use?
Yeah, a really important question when we talk about other drugs, right? So alcohol is just much more prevalent. 70% or so of college kids use alcohol, but it's still pretty high for cannabis, about 40%-ish, depending on the study, which is also higher than non-college
Hmm.
students.
Hmm.
Other drugs like stimulants, right? We think about Adderall, a
Yeah.
lot of use of those, this idea that it's going to improve my academic performance. I'll just do it
Hmm.
for finals.
Mm-hmm.
The data on that is pretty clear. It actually doesn't improve your academic performance. You may perceive yourself to be more attentive, but you're
Right.
actually not doing as well. And yeah, opioids tend to be lower for college kids to misuse than non-college samples. So it varies a little bit on the substance, but cannabis itself, because it's the second most commonly used, there's definitely a huge social conversation around cannabis. A lot of misinformation, unfortunately, about the effects of cannabis. Of course, it is less risky and dangerous than alcohol. It's about the ninth most dangerous substance you can use. A study was done looking at 16 substances, right? So
Hmm.
ecstasy, cocaine, Adderall, mushrooms, right? Cannabis fell about halfway, and only about 1 in 9 people do get dependent on cannabis, so most people don't. If you started using before 16 or under 25, you have a 1 in 5 chance of developing cannabis use disorder. So the younger you are and the younger you start, the more likely you are to develop problems with it.
Hmm.
I think most people don't have a problem with cannabis, right? I think
Hmm.
that's true, and it is less harmful. Doesn't mean no harm, and I think legalization has confused that a bit for people.
Right.
It's legal, it
Right.
must be okay, right? Or
Mm-hmm.
it's somehow legitimized. Medical cannabis is also confusing. The research is really clear on it does not improve psychiatric symptoms, but it does improve cancer pain, nausea, HIV related, other sort of medical physical things, but
Yeah.
not psychiatric status.
Hmm.
So there's just a lot of confusion about the role for cannabis in terms of mental health.
Yeah. We might have to get that list from you and put that in our show notes, something to
Yeah.
cite, like in case you're curious, right?
Right.
Where where does perhaps some of the ones you're trying, where do they fall? Because that's one of the things I was curious about too. Do you notice, and this might not be the kind of question with the most data behind it, but do you notice that there are certain things people would try? Like if I'm feeling depressed, I might try this, or if I'm feeling socially anxious, I might try this, or I'm going to try, study drugs for, or ADHD, they call them, right? Like the study drug is Adderall, the pep me up drug is alcohol. Like, right, are there types of substances based on the thing you're trying to fix? Or do you find it kind of depends on the person?
I would say ish. Yeah, I think there's some trends, but it does vary a lot by individual, definitely for like fun and social pressures, there's alcohol, right? And then
Yeah.
definitely for anxiety, cannabis. Like the downers, the cannabis, the opioids, the alcohol even tend to be used for folks that are struggling with like anxiety or those kind
Mm-hmm.
of up even anger, very
Yeah.
physical experiences, and then the stimulants for studying, and there's a cocaine sometimes to kind of bring you up from alcohol, so they
Mhm.
can be all mixed around. There's a general trends, but everybody's just a little bit different as to what is the kind of key to their lock,
Yeah.
as to what works for them
Mm-hmm.
exactly, and that's there's lots of reasons why that might be,
Right, right.
but
That makes
yeah,
sense.
just general trends. Yeah.
All right.
All right. So, what are some signs? I think this is, we started this conversation talking about atypical and typical alcohol use, and maybe we can end the conversation talking about what would be some signs if you're listening and are like maybe curious, like, and you're like on the line. Do I have a problem? Do I not?
Typical versus atypical category, right?
Right. That you might need some more help or support with your alcohol use.
Yeah, I think although frequency and quantity, so like how often you drink and how much you drink, aren't in our sort of fancy medical DSM-4 diagnosis manual per se, that is definitely something to be paying attention to. So if you're drinking probably more than once or twice a week, and when you do drink, you're binge drinking, right? So the 4 or 5 drinks, that's not per se a huge red flag. But if you start to go above that,
Hmm.
drinking maybe 3, 4 times a week, you may be noticing you need to drink more now, 6, 7, 8 to have the same effect. You're starting to have some consequences. So you don't have a diagnosis of an alcohol use disorder yet, but you're in that kind of moving into problem use. So, you're sleeping in frequently from class. You notice some of your grades might be dipping. You laid on a few assignments because you were hungover or too stoned to really remember what you were
Hmm.
learning in class, right? Even a red flag can be, your friends are a little nervous or worried about how much you drink. They're
Right.
saying, you might want to cut down, or you got really angry last night and I'm a little worried about how much you're drinking. So if you get some peer feedback,
Hmm.
that can be a warning sign too.
Yeah.
I think those are some big ones. So sort of peer feedback impacting your kind of functioning, right? You don't play as well at lacrosse or swimming because you kind of low energy, tired, hungover, and some academic impacts as well. Or you're starting to use a substance to try and kind of improve your performance, right? So
Yeah.
I think you were saying earlier, Liz, like sometimes people might use a little bump to get them through their
Right.
swim meet, right? That's when it might start to sort of have this sort of reliant pattern of the relationship between some kind of substance and functioning. And then when we get to kind of disorder level, that means it's really problematic, which is about 5 to 7% of college kids have some kind of substance use disorder.
Hmm.
That's really you're having tolerance, you might have withdrawal symptoms, you got pretty consistent impact on functioning. Maybe you drove under the influence or you engaged in risky sex behaviors while you're under the influence, you don't remember. It's really starting to move into it's greatly impacting. You might have gone into trouble with campus police more than
Hmm.
once.
Yeah.
That's sort of the space where it's moving into kind of maybe more likely disorder level. And you are going to have a hard time controlling it without really professional help.
Yeah. Well, so piggybacking on that, then, what are the resources you found? I know that is going to vary by college, et cetera, right? I'm sure that all the colleges that are in the Cambridge and Boston area probably have a different set of resources that they're kind of different strengths, maybe. But do you find that there are some go-tos for the average listener to say, all right, if you're starting to ask a question, like, and actually, even before I would say that, we had a friendship episode at some point saying some friends are just sort of anchor friends, right? When you were saying if people are starting to express concern, maybe if you're sitting there, there's a friend who you could trust, you could just kind of spitball with them and like, hey, this is a question I have, right? You're not asking them to diagnose it, but is there somebody in your life, friend or family member who you could just start to ask a few questions, right? I could imagine that'd be really nice. Not everyone has that. What
Hmm.
are some additional
Right?
resources you think are on deck for them?
Yeah, certainly a lot of people start with looking online, right? And so you can go to
Yeah.
websites like NIH, National Institutes of Health, NIDA, National Institute of Drug Abuse. You can look up some online questions that can do a quick screen as to whether you have a drinking problem. There's some short
Oh, that's
ones, and I'm happy to
yeah.
send those to you guys.
We
And
love
that's
that.
often where most people start looking on Google, right? And so there's
Yeah.
pros and cons to health searches on Google, as we all know, but that can be a good place to just take a look and see, am I drinking too much, and answer some of the questions. There's a couple of questionnaires that you could fill out that are free. Other than that, I think bouncing it off with a friend, like you said, have they noticed any concerns or behaviors with you? Definitely thinking about your college campus resources. They
Yeah.
obviously, depending on the college, tend to have at least a physician or maybe even a mental health social worker. Could walk in and talk to them. Of course, those are all private and confidential, and that's not going to affect your academics or your standing as a student, just to go talk privately and confidentially with someone about your substance use. If you're nervous about that, you can certainly look outside your college campus, maybe do a search for a local therapist or local expert in substance use that you could go and maybe talk to them about that. And there's some online kind of college resources. I can send you guys some links to that to share with your listeners about just some broad resources for college students who might be wondering if they have an issue.
Yeah, that'd be great. No, we'll make sure we share a lot of that because to your point, it's easy to Google, but sometimes it's hard to know where that's going to lead
Right,
you. So we'd
right,
love for
right.
people to find the right resource for them. And thank you so much. This is amazing. I think that it's so nice to hear that like it's typical to want to have fun
Hmm.
and that it's
Hmm.
okay also to decide that you can change certain things that are no longer working for you, right? If it was fun at some point, that
For
started
sure.
to shift. We just want people to know what to do when that's the case. So amazing. You're so smart. James, you're so smart.
Why, thank you.
I concur.
I'm
Yes.
Thank you for having me. I appreciate you being here.
No, we'll have you again sometime soon. So we'll come up with some other topics so that way you're forced to talk to me at least twice a year. I want something biannual. All right. Well, we'll sign
Thanks,
For
off.
James.
sure.
So nice to meet you. Thanks for being on.
You're so welcome.